जब पेट की अंदरूनी लेयर के सेल्स बिना रोक टोक बढ़ने लगे और कैंसर वाले ट्यूमर में बदलने लगे तो इसे पेट का कैंसर यानी गैस्ट्रिक कैंसर कहते हैं। लेकिन इसका सबसे खतरनाक पहलू ये है कि इसके शुरुआती सिम्टम्स आसानी से पकड़ में नहीं आते और जब पता चलता है तब काफी देर हो चुकी होती है। तो आज बात करेंगे स्टमक कैंसर यानी गैस्ट्रिक कैंसर की, और इस पर बात करने के लिए हमारे साथ हैं ऑन्कोलॉजिस्ट डॉक्टर मुदस्सिर अहमद। आपका इस्तकबाल है हमारे इस प्रोग्राम में।
Thank you. Hello, my name is Dr. Mudhasir Ahmed. I am a medical oncologist at Fortis Hospital in Noida, NCR, Delhi. I have a specialization in medical oncology and hematology, and I have been working for a long time in this hospital, Fortis Hospital, Noida. And before this, I had been working in Apollo hospitals in Delhi, in Hyderabad, and HCG hospitals. My training is in solid cancers, and in this hospital we are treating all the patients who are having any types of cancers ranging from the head and neck, breast, lung cancers, gastrointestinal cancers, colon cancers, gynecological cancers, lymphomas. And we have a complete comprehensive cancer center, and we have all the in-hospital services, including the medical oncology, the surgical oncology, radiation oncology. We have an advanced radiation oncology machine, and we have in-hospital PET CT scanner and all the MRIs and CT scans. We have extensive other departmental support in the form of pulmonology, neurology, neurosurgery, gastrointestinal surgeries and other surgical departments. We have extensive support from the ICUs and the other allied services. We have been receiving patients from India as well as from abroad, especially from the countries including the Gulf countries, Iraq and many other adjoining countries. We have been receiving patients from African countries, Ethiopia, Nigeria. We have been receiving patients even from other Asian countries, Turkmenistan, Bangladesh, and some other countries in the Far East Asia. And we can say that in our department we must have treated about more than 1,000 patients who have come from all these countries. And most of the patients which come from the other countries, they belong to they have many different types of, they have been having many different types of cancers, which may include cancers of the breast, cancers of the lungs, cancers of the nervous system, the brain, cancers of colon, intestinal tract, cancers of the bones, and cancers of skin and other things. As I told you that in our hospital we have all these services. We have services for the lymphoma and the bone marrow transplantation as well, and we have been doing advanced surgeries in the cancer patients, including the surgeries for ovarian cancers, including heated chemotherapy that's called as high-pec chemotherapy. We do intraperitoneal chemotherapy as well. During the last 10 years of my experience of dealing with the international patients, I have learned many lessons. The patients who come from outside, they do not have only problems of taking the treatment, they have also the problem of the logistics. So that means the supportive services right from their own country, when they get the opinions regarding their diseases and which hospitals and which places to go for the treatment, as well as their travel and as well as the logistic support of the travel in India, stay in India, their food preferences, their sometimes the official needs of certain documents which they need to have for the completion of the treatment, their stay in India, visa services. they are a big problem for international patients. So it is always better to have our friends like hospitals, who provide all these services. So these services are the crux of the treatment in any countries when the patient is not taking the treatment in his or her own country, and they are going to some other country for the treatment. So all these things are provided by the hospital, and so far our experience with the hospital organization services has been quite well, and we have enjoyed their services. And this turns out that most of our patients who come from this organization, they are well satisfied and they are well taken care of. And regarding my experience with treating the international patients, it is always a delightful experience to have people and patients coming from all over the world. See, when the patients come from all over the world, they usually come with their families, and they have so many expectations from us in India, so that we can give them good treatment, an up-to-date treatment, a world-class treatment. So so far we can say that most of our patients have been very well satisfied with our treatment and with all the services, and it has been a delightful experience, and I hope that it continues as such.